Yes, thanks, Jen and Carmen. That's really informative. Friends, before we discuss or share on module 4 and 5, I just want you to go to the shared function and share with me if you've realized some people in your community that have been stressed, and how did you recognize that they were stressed? Carmen is seeing they seemed agitated. Great. And as we share, allow me to share my screen to share the toolkit. So we are going to share module, to discuss about module 4 and module 5. Module 4 is about helping people who are experiencing stress, and how we are going to understand better how to support them. And Carmen and Jen actually formed a foundation for us to discuss about this. So first and foremost, the first thing that you need to understand about is the science of stress for you to help these people. And this comes about by you understanding the science of stress. And module 5 is about helping in specific situations. So we are going to learn about those two experiences. So if you look at this, you'll understand that it's actually natural for people in currently unusual times to go through stress. And people are actually going through stress in different ways or different manners. And because of that, you'll find that stress is being manifested through different ways. There can be some emotional reactions like feeling sad or angry or being scared. Some ways can be some physical reaction like headaches, muscle pain, or difficulty in sleeping. And also we have some behavioral reactions such as lack of motivation to do what they previously used to enjoy doing. Some are violent, and some people actually avoid doing those kind of activities that they used to do. So if you realize this, in this module, there are few relaxation activities that you can propose to the client, or you can also try yourself. One of those is the breathing, slow breathing exercise, whereby the client or yourself can breathe in slowly, then breathe out again slowly. Another case is from this Julia's and Josephine's case, in which Julia is helping Josephine address their stress. So if you look at that, it can be that some people might experience stress or have some prolonged kind of stress, which in this case we refer to as distress. And some, when this happens, it means that they may be seriously distressed. And in such cases, you will need actually to refer the people for some specialized support. Remember about linking, in which Carmen shared about Appendix A, in looking at the mapping out the resources and the routines in the area and linking this individual for appropriate services. So what you need to understand is that there should be safety first for you and maybe your client. So make sure that the person that is safe from harm and also that you're safe from harm. You cannot help them if you're not safe. So actually let them know whom you are as what we do in clinical practice by us helping out our clients, addressing them by their names, them knowing about your name. So these are some of the things that you can do during a session with your client for them to be feel safe, for them to feel as if they are being helped out. And there are seven aspects. You can see the last one of the seventh one on providing clear information. That is really key and necessary, because they really need the information that they need. If you are to refer them for more help, then it's critical to refer them for that appropriate care in that particular setting, not in a different area. And that's why it's necessary for you to do mapping in your area and understand. And that's it's talked about in the 9th area on referring for specialized support. So You will realize as we go through these modules, especially module 5, that there are some links provided for more support, for more reading materials, so that when you go through the reading materials, you're able to understand the module in deep details, especially when you're helping people of specialized population, as we are going to discuss. So module 5 is basically about helping people in different scenarios. And you can have various groupings of people in the community, in the emergency area, people who are vulnerable, and because of their vulnerability, sometimes you might find that services are not able to be provided to them, or people tend to be biased towards them. So you, for instance, we've realized how COVID and the people in care homes are at risk. So you can look at this and see that these people need support. They need extraordinary support for you to help them. And like I've said, more of these resources, you can find them on this bracket, and you'll realize that in each and every discussion that we have, there is a small box of additional resources that you can read and understand. So when you go out to train other people, then you have an in-depth understanding of how to help. When you go out as a helper, a community helper, to help people in these various categories, then you understand better how you're going to help them. Secondly, we have women and girls who are affected by COVID-19. And COVID-19 has forced us to stop everything that we are doing, to be indoors. And so women and girls can be affected in that there can be some increase in gender-based violence towards them. So you really need to understand how you're going to assist the young girls in your community. You're going to assist the ladies in the community, especially at the moment that they are at risk of being exposed to GBV or any other form of intimate partner kind of violence. More of these resources on how to help you can find on the United Nations Women Policy Brief that is attached to the module, to this toolkit, and the same as the IASC Protection from Sexual Exploitation. And all these are related to COVID-19. So you can go through them, understand them, and help better people in the community. Also, you can be able to support people who are grieving. Remember, with COVID-19, we've been able to change our burial systems and our burial ways, especially if you're working in communities that believe on doing it better in a cultural manner, then you'll understand that the cultures tend to change. So the grief might be so much because of the change in culture. So you need to understand about that community. You need to understand about how you're going to help or support the people who are grieving so as to better help them. And again, much of these resources, you'll find them in the small box in that place. Before we continue to the other special group, do we have a question up to there? Any?
I do.
Okay.
This is Hivine again. Thank you, Brian. So in module 4, you mentioned that there are people who experience stress and there are others who experience more intense stress. So yes. My question is, in this guide, will this guide help us in addressing the needs of both categories?
This guide currently focuses more on those people who are going through less adversity, and that's why it proposes that if people you realize they are undergoing through prolonged stress, then it's better to refer for additional support. That's why, as we discussed, you need to map out the support that is being provided around the community. So if you notice that your client or your friend or someone is going through prolonged stress, then you can be able to refer for additional support.
Okay, thank you.
Thank you, Yvonne. The other group of people are people living in refugee camps, or people living in IDP camps in our various communities. These groups are vulnerable in that they don't have the access to the basic needs or the basic stuff that they need for their day-to-day survival. So you can go through these and find out in this resource from UNICEF on how to help these people. You will be able to understand their needs, how to approach them, and how to offer your services, and even how to refer them for extra services in the camp. Also, we have people with disabilities, and people with disabilities, actually their greatest challenge is access to services, like we all know. So how do we make sure that they're able to access the services that they require for them, especially during this COVID-19, where maybe public transportation has been destabilized in your area? How do you understand and go and help them be able to access this kind of services? So this was the last group, and I think if you have a question, you can ask, and we can discuss. Anyone with a question on both modules, module 4 and module 5? If not, please, you can look at Appendix E on how to map out various services in the community. You can also look at Appendix B on setting routines so that you help them address their stress, so that they can begin with doing what they are able to do that is easy as they go to the hard areas. Also, you'll find an appendix on muscle relaxation technique. So if they are not comfortable in breathing exercises, then you can go into muscle relaxation technique. And I can see Gita's raised her hand. Gita, please.
Yeah, thank you, Brian. I was just wondering, maybe you could say a bit more about how do I know what organizations are available in the area? Do you have any recommendation of how to find out, or how to work with that, so that you can link people to relevant support, as you said, people who might be more distressed? How do I know where to link them?
Yeah. During a crisis, there can be so many organizations in the surrounding area who are offering various kind of services. So it's upon you and the organization that you work with to understand what your neighboring organization they are doing. So once you've understand what they are doing, then you are able to refer your client for appropriate support, whether be it for food, whether be it for shelter. You'll be able to understand that concerning the organizations that are working in the same vicinity or in the same area as you are, where you're based. Okay. Thank you, everyone. This has been great. I would ask Carmen and Jen to join us for our last say. Thanks, everyone, as I stop to share my screen.
Thank you, Brian. So just before we finish up, I want to show you a quick video from one of our colleagues in IRC in Myanmar, Dr. Nweni, and she will be talking about how she's used the basic psychosocial skills guide. So with this, perhaps audience members and people who are watching this later, you could just be thinking about how might you use these skills, or even the BPS training in your everyday work. Okay, thank you.
Hello, my name is Dr. Nweni Wade, and I'm working in Myanmar with International Rescue Committee as a public health specialist for MHPSS. I have conducted the COVID-19 MHPSS trainings to healthcare providers such as doctors and nurses in Yangon during COVID-19 crisis. Those trainings mainly focus on basic psychosocial skills. Since healthcare providers are frontliner support to communities, they have to work closely with people who are experiencing stress and need to support them, not only through medical treatment, but also by using supportive communication. The trainees were trained on how to practice communication skills such as active and empathetic listening, body language and facial expression, and how to provide support to people who are experiencing stress during COVID-19 pandemic. We also practice relaxation techniques such as deep breathing exercise to support the well-being of frontline workers and also in order to support someone who is feeling stressed. The basic psychosocial skills guide contains very practical advice and guidance for anyone working to respond to the COVID-19 pandemic. Thank you.
Thank you. Well, thank you so much for being with us today. And we hope this serves as a little bit of a look into it. Of course, it requires that you read through it and you go through all of those links that you can find throughout the guide, but we really think it can be very useful in your daily work. And these are skills that even for yourself, for being calmer, for being more rested, and to knowing how to interact better, they'll be very useful. So we hope this webinar was useful. We hope it is useful for those who will look at the videos afterwards. And that's all from my side. Over to Jenny.
Yes, thank you very much, everybody, for coming today. And as Carmen says, we hope this is helpful for you. Yeah, thank you, everybody.
Thank you. Enjoy.
Thank you.